Kari Karsten, and I'm a product manager here at IMO Health. I focus on our core procedure solution, which is really centered on helping healthcare organizations clean, standardize, and maintain their procedure data so it can be used across multiple workflows, including clinical workflows, billing, and reporting, and doing also reliably. When we talk about procedure data in clinical dictionaries, what we're mostly talking about is that foundational data and the code systems that help power how care is ordered, documented, and billed. So things like lab tests, imaging settings. So in practice, that data includes a mix of multiple things like human readable terms that clinicians are searching on, internal IDs and metadata that's used behind the scenes, and mappings to standardized code systems like CPT, Blink, SNOMED. We're all pretty familiar with those. And all of that is living in those large dictionaries. And those can they really are the foundation for nearly everything downstream in the workflows, from ordering to reimbursement to quality reporting. Over time, these dictionaries become incredibly hard to manage for really a few key reasons. First of all, they grow rapidly, and most dictionaries often contain multiple thousands of records. And on top of that, they're constantly changing. So you get your code systems like Blink and CPT that they're releasing updates multiple times a year. They're also often maintained manually, which is going to lead to inconsistencies when you have manual interventions to keep data up to date. And there's multiple ways to represent the same thing. So what we typically see when we're working with customers is dictionaries that are filled with duplicate or outdated items, missing or incorrect code mappings, inconsistent naming conventions, and without strong governance processes. It's really complexity that's compounding over time.
When procedure data isn't accurate or well maintained, it definitely has a ripple effect across the entire organization. You'll run into things like billing and reimbursement issues just due to incorrect or possibly missing codes. You might see delays or denial in prior authorization workflows, inaccurate quality reporting and compliance risks. So when we think about programs like USCDI and CMS, that's what we're really talking about there. And then most importantly to me, you're going to have operational inefficiencies. So you're spending more time having your staff fixing data instead of focusing on patient care. So at its core, poor data quality, it really is undermining the trust in the data. So when that happens, it impacts both clinical decision-making and your financial outcomes.